Laura, thanks for coming in to see it. Can you kind of give me your background and what you were experiencing with respect to dry eye?
Sure. So the funny thing is I didn't even think I had dry eye. When I was asked, I don't use drops, etc. But at the same time, definitely noticed some vision correction with my eyes needing to blink to be able to see more clearly. But most importantly, it was the corneal ulcers that I've had over several years, many times in both eyes, and definitely something that we were all getting concerned about.
How much did the corneal ulcers hurt?
A lot. And I actually would get in right when they started. Dr. Gittens was always surprised that I was able to see them, feel them, and get in right away. So I can't imagine if I'd actually let them go longer, what it would have been like.
So when Dr. Gittens said, hey, you have some dry eye that's causing the tears on the cornea, what did what was your response then?
Let's talk, let's figure this out, let's tell me where I need to go. So he obviously brought me this way, and once we started going through and seeing some of the tests that I was doing and the partial blinking and things, it was becoming very clear that there was an issue there.
Okay, so then we talked about the glands and that they were getting blocked, and that's why we weren't getting the oil layer there in order to maintain the lubricity and the tear volume of tears that they were evaporating, which then would expose the surface of the eye. So then you chose to do LipiFlow. What was your experience like with that?
I actually found it quite relaxing. It was probably one of my only times I was away from my electronics and during that day. But really to have just that piece of equipment in my eye, and then all it was really was warmth and a little bit of a massage. Kind of felt like you were in a spa. You were there the whole time. It wasn't awkward or strange.
It didn't hurt.
It did not hurt. It did not hurt at all. You just know that it's there for 12 minutes and go with it.
So what was your response afterwards?
Well, as I mentioned earlier when we spoke, that it literally was almost immediate, that I felt the difference, that I could feel some moisture and thinking, is this what normal people feel like? Today I'm wearing contacts or glasses just because I knew I was coming in to see you, but usually I've been wearing contacts. I've actually been noticing that they're a lot easier to put in and take out than have been. But one of the biggest benefits, aside from just feeling a lot more normal, and even like I said, when I came in, just taking the test, I didn't have to blink as much to take the test, and I was hitting the right letters. But I've also noticed a lot less yellow in my eyes, and my husband actually noticed it without me noticing it.
Wow.
Or mentioning it to him. So it's been great. I really am glad I did it.
Wonderful. Well, thank you for being our patient. Thanks for taking time to share.
Yeah, you're welcome.
We really appreciate it.
You're welcome.